Our session is on mental health. The theme is generally about empowerment, and my first speaker is here already. I have the pleasure of introducing Dorcas Gwata. Dorcas Gwata is a global health consultant, a very extensive and impressive biography. You've worked with young people and families mostly affected by gang culture recently in London, but it goes beyond that. Dorcas has worked a lot with domestic violence, with gender-based violence issues, with a lot of sort of mental health difficulties, stigma. And I was quite impressed to know that you actually worked with the Zimbabwean Friendship Bench, which I know has been a tool to remove stigma in having difficult conversations on mental health and engaging people. You've also, again, extensive experience in Africa, Asia, Europe. Like I said earlier, you're a lecturer, you're an educator, you lecture at London School of Hygiene and Tropical Medicine and King's College London. You've been awarded with the International Human Rights Award through Surrey University. And you're the founder of quite a few projects. I was interested about the Global Health Cafe and the Gojo project, which I think you're going to talk to us about. I understand you have a keen interest in merging mental health and art. So really interested to hear your talk on mental health leadership and community engagement projects. I beg all of you to really focus and give Dorcas your full attention. Over to you, Dorcas.
Assalamu alaikum. Thank you for having me. Can I please share my screen? Thank you so much for having me. Professor Adam, thank you for reaching out. Thank you for including me in this important discussion. And I'm honored to be around so many amazing women, but also men who support us. We can't do this without you guys who support us. So thank you very much. This work speaks really to the global health space. It sheds light on the fact that our world is one world. What happens in Zimbabwe and Sudan is relevant in the Middle East, is relevant in London and Washington. And my heart sits in two spaces, which is Zimbabwe and London, spaces that I both love. This is some of the work that I've done, and I think Sara kind of touches on it. But if you pay attention to the bottom right where it says hospital cleaner, that is probably the biggest point in my CV that I can shout out today. When I came to this country, I worked as a hospital cleaner in Scotland, and I probably learned more in that job in a couple of months than I would have in my later years as I navigated through the NHS and through the global health space. Why? Because this is where the socioeconomic issues are. We hear a lot about Africa and Middle East struggling and India struggling, but actually there's poverty right here in Britain. And this will become my major interest of research. So really today we're looking at innovation at a time of vulnerability. How do we innovate? When we're right down on our knees, that's when all the opportunities arise. And I'm hoping we can shed some light here on some opportunities to innovate, but also some challenges that come with mental health. That's the scope of discussion. I want to pause here for a second and honor our colleagues who are serving on the front line, wherever they are. Those we've lost on the front line, those who've died, those who've left children, and those who are serving today. They deserve our honor and our highest gratitude. Thank you. So we navigate this conversation today. We might want to pay attention to some of the tools that are available to us. Certainly tools that have been available to me through my program at Women in Management program at London School of, at Oxford University, Saïd Business School. These tools were already available to me, but they're only heightened. Cultural intelligence, emotional intelligence, highest tools, the power to listen, the ability to collaborate and look outside health, and the ability to look at power of community engagement. Problem-solving tools. We'll look at these when we look at the Friendship Bench project in a second. Further tools, the values we place on ourselves and we hold in ourselves, whether they're around our faith and our being, the quick wins, and the spaces that we allow ourselves to be and tell our stories. Storytelling is one of the greatest traditions of African cultures. Ours is an oral history. It's not necessarily a documented one. And so when we return to those values and we're able to tell our stories, something happens in us that brings our identity through and our values through. This ability to critically analyze and influence. And I'll come back to influence, how women can influence it that much better than we already are doing. But allow me to pay tribute to some remarkable women in our continent. Edna Adam, Somaliland, built a hospital on her own accord. And Edna said, I will build a hospital. And she said to NGOs, I will accept any change, but only if you allow me to tackle FGM in the community. That's a trade-off. That's leadership. Mary Seacole, you will hear of Florence Nightingale everywhere you go, but not necessarily Mary Seacole, a Jamaican nurse who would have crossed borders from Africa, from her descendants, all the way to Jamaica and back to England, to Europe to nurse patients in the Crimean War. Again, remarkable leaders of our time. And Winnie Mandela, purely because leadership in women is not always linear. Leadership is controversial. Winnie was controversial. And I stand true to the fact that every woman should be buried with a jury. Winnie should have been buried with a jury. Just a remarkable, remarkable woman who, again, was a wife to a remarkable leader. I was born in this village right here in Zimbabwe, and in a very deeply patriarchal society. The lady in the middle is my aunt. When she married into that village, she had absolutely no power. But as she navigated through and she's come through, today she holds probably some of the highest power in the village, more power than my uncle who's on the right. So there's something that happens with gender in terms of our balance and our vulnerability. We're vulnerable, deeply vulnerable entry point. But as we go through and trade through the powers, we navigate that space, we become so powerful that I have seen men shiver around her space because she holds that power. But I'm not denying this. We are absolutely vulnerable. My interest in mental health came not far from this place, about 10 miles away when we would move on to a small village. When I was a teenager at the age of 17 years old. We were waiting for our results. And I was very anxious. And a friend of mine committed suicide. He was waiting for his results. He was 17 years old. He was so anxious because his parents had said to him, we have spent all our money educating you, you'd better pass. He died a gruesome death and he came back, the results came back in 2 weeks' time and he had passed his exams. I think that was my entry really into mental health, this vulnerability that we have. So this is London, a space that I live in and I'm presenting from, a place that most of us probably know for its glamour and the royal families and money and wealth. But inside this pocket of space here are deep pockets of vulnerability and poverty. Many of those are from minority groups. When I was hired by the Mayor of London a couple of years ago to look into mental health interventions for young people involved in gangs, it was very clear instantly that my cohort and study group were 80% from minority groups. Many of those were from migrant families who migrated from Syria, Kurdish, Somalia, from war zone environments, to move to our city only to lose our kids to gang crime. So we had to do something different here. And when I knew that when I took this job, I had to look elsewhere for solutions for culturally adjusted mental health interventions. And off I went back to Africa through the Friendship Brain Project. But with every loss, every child that we lose, every 15-year-old that we lose in London, there is grief. I took this very private picture in Regent's Park Mosque just before the pandemic. We were burying a young man, 17 years old, Yusuf, stabbed in the street corner of Edgware Road. He died. And I remember his mom, who was supporting, saying they should have taken me. I remember another mom who lost her son. And she was from Sierra Leone, and she said, I survived Ebola, I survived everything else, but I could not keep my child safe. So COVID-19 has really only landed on a bed of inequalities. This was the other pandemic that we're dealing with in London before again. And you can only imagine the multiplication of these issues. So how do we get around mental health and solving issues and getting ourselves through where there are no psychiatrists? You could argue that there are thousands of psychiatrists in London, central London, but are any of them willing to see my young boys who are exposed to violence, who are carrying a knife? Very few of them are. So Dixon Chibanda's work, which is a Friendship Bench project, looks very much at this. And how do we solve interventions in the absence of psychiatrists? There are no clinicians, there are no psychologists, there are no nurses. If you look very deep down in that level of community, we have labor health workers who are embedded in the community. Could we do something with them? And what Chibanda did in Zimbabwe was he worked with grandmothers sitting on a bench. He said, if you take a problem-solving approach, simple tool of depression, anxiety, use cultural terms, don't call it depression, don't call it anxiety, let's just call it problems, because everybody has problems. For common mental health disorders, we could just stick to very simple terms which are culturally accepted. Sit down on a bench and list 3 of your problems, and let's look through them. And for sure, many of their problems were mother-in-law, finances, and land security. Most of the women, if they were divorced, they had no rights to land and whatsoever. When Chibanda improved these health outcomes, he realized that you can also improve HIV adherence in an area. So he planted his work in an area with high prevalence of HIV. And today, here we are, using a very, very simple tool of task shifting, cognitive behavioral therapies, delivered by lay workers, many of them grandmothers, in areas of high exposure to poverty. And when you do that, you can improve both health outcomes for mental health and for HIV. But guess what else you can do? You can improve the health outcomes of your own workforce. So the grandmothers themselves turned around and said, our health outcomes are actually improved. So I wanted to take this back to this work, Chibanda's back to the high-income countries, and challenge this trajectory that everything that is pure and brilliant comes from the global north. And I brought these very tools into my work in London, the Friendship Bench. And here today we're not able to save every teenager in London from knife crime. What we've been able to do is contribute to a body of evidence with the Mayor of London, Sadiq Khan's work, which is phenomenal in this form, and say at least for our BAME kids, these are the issues that are underpinning. Domestic violence is significant. The absence of a father in a young man who's already vulnerable and disturbed can have significant impact. Inequalities matter. Language matters, and adjustment matters. And above all, school exclusion. Please do not exclude our kids. Please do not exclude our Black kids from mainstream education, because when you do that, drug dealers are waiting to recruit them. We're back to Timbare, and this is another example of the GOGO project. Again, a use of young people in this very same area that I was pointing out at. Young people are phenomenal and incredibly innovative in the way they deliver interventions. So we were working with a group of young people already in Bari. And at the beginning of COVID-19, Zimbabwean government asked all the grandmothers who were selling sweets, and also they were making their living per day to go back home and isolate. They were not able to feed their kids. So we started this project really out of my own pocket. And then when you start something, and this is what women do, I don't think we get acknowledged enough for this. We start something. And when we start something, people come along and support. And I think the GOGO project can only really be spelled out by this video here. It's only 2 minutes, really. Thank you. Thank you. So what are we doing at the GOGO project? Essentially, we're supporting grandmothers and grandchildren. In the wake of political instability in Zimbabwe, a lot of families have moved abroad to South Africa and left children unmanned, looked after by their grandchildren. So $20 of groceries, mental health awareness package, sanitation, and then the very issues that are really difficult in our culture sometimes, teenage pregnancies. When those homes are left and there are no parents, we have 13-year-olds and 14-year-olds who are falling pregnant, one because they're out of school, two because they are living out of poverty. So for at least for sub-Saharan Africa, poverty has to be addressed. We can only, when we really address poverty, can we then nest all other interventions. But here's what other young people told us. During the pandemic, there was no school, there was no food in the house. So we're turning to older men who can feed us. Positively, they told us we're more open about our own mental health. We collaborate with artists and families to address issues with children and families. We address substance misuse in communities. And we want to expand this intervention to rural areas. And one young lady who works with us said, I want to become a social worker. I want to help other people. So let's look at what we're doing ethically. And too often Africa doesn't get credit for ethical trading. Nothing goes to waste in Africa. We all know that, nothing, absolutely nothing. So our groceries are sourced from this lady who's standing by a corner, and that's a peanut butter. If we buy all that peanut butter from her, that's about $10 US. That means for that $10 US, she's able to go and support her own families. So there are win-wins here for climate change in Africa. Again, women leading at the whole of this. I want to challenge the audience a bit here and say, if there was a man standing there, and at least for Zimbabwe, let me take that responsibility. There was a man standing and I bought those peanut butters for $10 US. $1 might make it to the family. The rest is probably going to go for a drink. That is the bottom truth. So let's have this conversation about this continent that we look at, Africa. There was a conversation to be had in the wake of Black Lives Matter, in the wake of COVID-19. We too must have a conversation about decolonizing global health. This whole idea that everything brilliant comes from the North and that we should, as Africans, just sit here and wait to receive. I challenge my own continent. We have to improve our governance structures. We must improve food security. We must improve health security so that our brothers and sisters are not dying in the Mediterranean trying to get to the West. But look, what if we were bold enough as women today? What if we're bold enough to say to the West, every time you send a volunteer to my country, to Somalia, to Sudan, to Malawi, I want one person coming out of that country also going to the global North. It's a win-win. Those are equal. Why on earth are we accepting volunteers, all well-meaning, but they don't necessarily all impact well in our community? This is a picture of one of our artists from Zimbabwe who's very helpful. She was actually singing in the video, Gemma Griffiths. So there are unconscious biases that I think we are not challenging enough. We need to be able to challenge them, but we must find a balance And that is the job of leaders, to be able to find that balance, to challenge accordingly. Innovation is important. The Global Health Cafe is a platform that, first African platform that was formed by myself and Ade Adeyemi, CBE, who's based here in London. Every time I gave a lecture at the London School of Hygiene and Tropical Medicine and King's College, I'd give a lecture and I would ask, does anybody have any questions? And there would be silence. As soon as I finished the lecture, I'm heading out the door. A stream of young women, mainly, would come to me and say, I have a question. I began to ask myself this question: why were these young women not brave enough, vocal enough to stand in front and ask their questions? So we created this platform, which is Global Health Cafe, which focuses purely on Africa's burden. Why the focus on Africa? Because Africa carries the heaviest burden of disease. We have it all in terms of the variables that compound negative mental health, general health. Our health systems are incredibly poor for political reasons. Our politics do not support health. We don't fund health, not attractive health, unless it's private health. So I'm grateful to see this baby project that we organized here in London growing and mushrooming in a true spirit of leadership. When you birth a project, you don't hang on to it. We've handed this project back to where it belongs. It belongs to the community, it belongs to young leaders. And today I'm incredibly proud to be supporting and mentoring young women of African background through my mentoring program, again, strengthened by the leadership program that we have in Oxford University. I'll round off my talk and address mental health in our own selves, in us. I come from a very vulnerable place of mental health in my own family and deep vulnerability. I may be very powerful here in my own job, but actually when I go back to my village, there are many structures in place that hold me back as a woman. I'm not allowed to own land in my own village because of the cultural structures that are in place. So when we look at mental health, in many ways, women are affected by their own mental health, but the workforce itself is affected by mental health. I work in an accident emergency department in London, in central London. Every time a medical student, every time a doctor, every time a social worker who is working in the system is wheeled into my department, having taken an overdose or tried to kill themselves. Every time a GP who's 6 months away from retiring is wheeled in because they've taken an overdose, trying to kill themselves. That has us questioning ourselves about, are we doing enough to look after ourselves? The front line of COVID where I work, with pride and deep pride, is also very stressful. We've lost our colleagues. The first 10 doctors to die in COVID-19 in England were all British Muslims. Why? Smokers get a break. Are my colleagues not getting enough a break for a prayer room? Do I get a break for a yoga mat in my department? I don't. If I ask those, I'm asking too much. So there's something deeply racist about the front line, and I want to be very bold about that. I serve with pride, but it breaks my heart to hear my own patients saying, I do not want to be treated by a Black nurse. I don't want to be treated by a Muslim doctor. I want to be treated by somebody white. We are racist in our age, but how do we deal with this? It's the job of policy to protect frontline workers. It's the job of policy to protect those who serve. Because without a strong healthcare system, the biggest asset of that system is not buildings or X-ray machines. It's the people who serve in them. So this is my greatest push at the moment, all the way to WHO, where my colleagues are based, that we have to have stronger programs in place that protect the mental health of those who serve in the very system. Thank you for having me. I'm very grateful to have had this conversation.
Thank you. Thank you very much, Dorcas, for a very powerful, very emotional talk. Actually, I was supposed to be taking notes and I just got so hooked into the talk. I didn't take any. Really inspiring work. Respect really for all the work you've done. We talked earlier that there was some sort of talks in the earlier sessions about having to lead by modeling, by sort of doing things that were on our own. And you actually do that. I've heard a lot about the Zimbabwean Friendship Bench and sort of the way it being used as a tool to remove stigma when having difficult conversations. And lovely to see how you managed to bring that sort of from Africa all the way here to the UK. All cultures, this is a melting pot, isn't it, in the United Kingdom? And it's really not right to consider that what works for some people would work for the other people. We have different cultures, different backgrounds, and to open conversations, difficult conversations regarding domestic violence, regarding gang culture, regarding all types of things, the poverty aspect, one does need to feel safe to be able to open up and talk about these issues. Really impressed with the work you do, and it's lovely video to see about the work you've done with COVID back in Zimbabwe. I don't want to monopolize the conversation because I can see there are a couple of, let me just check here. There's a hand up by Mohammed Karkab. So I'm going to give a couple of people, because we've got some time, opportunity to ask questions before I end up with a question. Mohammed, do you want to go ahead? Prof, can you unmute Mohammed Karkab, please?
Can you hear me?
Yes, I can.
Yes, thank you, Dr. Sara. Thank you. I'm sorry, this is my second chance, and I hope I haven't monopolized, taking all the questions and chances. I'm nearly crying when I was listening to Dr.
Dorcas
presentation. Her village actually reminded me of my own village and my own background. So I'm really impressed, and thank you very, very, very much. Once again, I'm going to ask about a question that is really close to my heart, which is domestic abuse, and particularly the experiences of Black and ethnic minority women who suffer domestic abuse in the United Kingdom, and in particular in London, because I have worked in that area. And the mental health, the opportunities, the chances for those women to get support for mental health departments is absolutely abysmal. I worked in that, and I used to refer survivors of domestic abuse. I don't like to call them victims. Survivors of domestic abuse to mental health authorities, and it's absolutely terrible because most of the clients I work with do not speak the language in the first place. Some of them they need a culturally appropriate counseling services to be particularly targeted to them, be them from African backgrounds or mainly I work with African women, And by the way, I am a man working with women, so I am a supporter. I also worked in the area of including. I try to include men in women's issues. I work with Amnesty International in a program to kind of try to include men in domestic abuse and including men. I mean, the mental health issue for African women who survive domestic abuse in London, I'm speaking about London, I don't know about the experiences of other cities in the UK, is absolutely terrible because we do not have enough counseling services or mental health services that are specialized to work with women from minority ethnic groups, particularly if I may be particularly specific, working with women who speak Arabic-speaking women. The doctor mentioned something about cultural structures, which is absolutely a brilliant point. When she said that, when she goes back to home, there are some cultural structures which do not allow her to live her life as she would like to, which is she can't, for example, own a land. Those cultural structures, are also pertinent. They are also persistent in our for so many women, and in particular for Muslim women. Cultural structures like, for example, if you are a Muslim woman and you're surviving domestic abuse, there is a cultural structure which says that women should always obey their husbands. You should always listen to what your husband say. I have worked with women who were not allowed to leave home without getting permissions from their husbands because of cultural issues. well, because of sometimes what religious guys call cultural issues. They may not be cultural issues, you know. I have worked with women who survived domestic abuse, who lived imprisoned, actually literally imprisoned in their own homes because they survived domestic abuse. They cannot get divorce. Even if they get a divorce, a civil divorce, they struggle to get Islamic divorce because simply to get an Islamic divorce is actually is the right of the husband to grant. Can you hear me?
Can I maybe add
in? We can hear you.
Yes,
Let's give Dorcas an opportunity.
Sorry, Dorcas. It is a husband right to grant. So can you imagine a woman who survives domestic abuse? She cannot get divorce from her abuser because he has a right to divorce her. I have been to 10, 20 mosques in London to try to get Islamic divorce from my clients, which they all declined because unless the husband said, I divorce you, she will struggle. I know there are other alternatives. I'm sorry, this is my last point. I know there are other, Sarah, you are smiling because I know you're coming from. You know where I am coming from. I know there are other alternatives. There are other solutions, but they are so difficult for women. For example, applying for divorce to the Islamic Council, right? A woman needs to pay around £800 for an application. Can you imagine a woman who is not employed, she doesn't work, she blah, 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 blah. She can't apply because she couldn't get the £800. And even if when she gets the £800, it took them years and years to sort out her. Sorry about that.
We got the point. And I'd like to hear Dorcas to come back to you on that. Yeah. Oh, thank you. Dorcas, do you want to?
Look, very deeply, obviously, very passionate about this. And thank you for your contribution, Mohammed. These are issues that I hear when I walk through those council estates. When I knock on those doors, I go through those coffee houses, sit down with women and men. These are issues. But look, something's happening in our society, which we're not acknowledging. And then there's a conflict of history and culture here, which is happening. At least for sub-Saharan African women who live in the UK, women are outweighing men in the sense that they are the breadwinners. Black women in general do better than men. That's just the data's there and is supporting that. So what happens when the woman becomes the breadwinner in this context? And in some ways, we still want that woman to be a village woman while she's living in London, right? Because we want her to have the PhD, she can have as many PhDs, she can have as many masters, but when she comes back home, she needs to be, that woman that we married. So this is where the conflict is. And how do we match that? How do we live with that? When we look deeper in our communities at the moment, when I knock on those doors and I'm looking for a 15-year-old who was caught with a knife down the street, I find him in bed, 2 o'clock in the afternoon. But his sister, who's 15 or 17 or 21, is already in university. And she's a medical, she's doing a degree in medicine. So the girls that we preserve at home, so importantly, because that's what we do culturally, they're the ones that are uprising. And they're ending up in very, very big positions. And the boys are not so, because there's a way that we're raising boys, all of us, in this pressured way that you are the man, you will take care of the name, you will carry this name forward. But what we're not doing is reinforcing some very strict parenting to boys, in the sense that we leave them be. You can come back at 1 o'clock in the morning, that's always absolutely fine. Well, what values are we teaching our boys? These are the same boys that must marry these girls. These girls are too empowered. So I'm not looking at my generation of thinking. I'm looking at the generation behind me, because that is my study group. What is happening with those teenagers? What kind of young men and boys are we raising? We may not get that Islamic divorce today for that woman today, but in 20 years from now on, what kind of a generation do we all here want to be raising? Donna Cannell, Royal College of London, I'll finish here, said, our greatest responsibility, all of us, is to be great ancestors. What are we going to be remembered for? I want to be remembered for empowering a next generation of young men and women who are more responsible to the issues that sit on our doorsteps today: domestic violence, substance misuse, knife crime, migration. Those are issues that are absolutely embedded in our communities, but they need us to tackle them. And I want to be raising the next generation that takes that on forward. Thank you.
Thank you. Thank you very much, Dorcas. Absolutely, one can hear sort of you are living by those values and that passion. And it's great to see sort of women, Black women in positions of power, and through your own effort, through your own work, again, a very inspiring journey from being that hospital cleaner to where you're now in a position actually to make changes and to be in a position to drive change as well. Your talk has been absolutely inspiring and really fits the day. Thank you very much.
For me, education is the key for my future.